And with that, I would like to introduce you to our presenter today, Bruce Barcelo. Bruce is the Director of Education and Prevention for Solder Technologies and serves as faculty at the Breathing Association. He is a retired teacher, coach, and principal. He has taught at the University of Dayton and is currently teaching at Antioch Midwest University. He has been the three-time chair of the Tobacco-Free Ohio Alliance and is an active volunteer with Parents Against Vaping E-Cigarettes, or PAVE. He has written and been published in multiple periodicals, including a vape prevention curriculum for solder, and has been published as recently as this morning, where Bruce had an article in the Dayton Daily News, which you can find uploaded with other resources in iEcho. Bruce presents at many national and state conventions and coalitions on tobacco and health-related topics. He has been the recipient of Ohio's Outstanding Health Education Award and the Healthcare Professional of the Year Award. So welcome, Bruce. We're so happy that you're here and excited to learn from your experience.
Thank you so much. All right, let's get ready. There is my presentation up. There we go. Oh, that worked nicely. Great. Well, thank you. We're going to have a good time today. Especially, I get real excited when we look at tools for schools. There are a lot of resources, so we're going to have a lot of fun. We've already, it's not moving. Okay, why? Hold on. There we go. We've done that. Let's move up. Let's back up one. So when we start looking at what is evidence-based, ODE, Ohio Department of Education, all and those that are joining us from other states and maybe from around the country, all states will have information on what prevention education is required by the state and the Department of Education. So on the website for the Ohio Department of Education, all prevention education is listed. And so the requirements as far as Ohio law is also listed. And so as you would go, if you were to go to this website and then scroll on down on this screen, there will be specific then Ohio law requirements around safety education and all those different requirements. So a great resource for all of us to look at on Ohio Department of Education. Then on the Ohio Department, OMOS, Ohio Department of Mental Health and Addiction Services, looks to then SAMHSA for additional definitions of evidence-based prevention. And when you boil it all down, really, the key is evidence of effectiveness. We could have a whole session on what evidence-based prevention is, but that's really what we'll look to as far as defining it for today in school-based. What is effective? Evidence of effectiveness. Ohio law then goes further in defining what evidence-based prevention is. What is the research around the findings, evaluation that shows positive outcomes, even promising evidence. It mentions promising evidence of at least one well-designed implemented study. So again, Ohio law gives us even further definition of what evidence-based is. And we understand why there needs to be those parameters around evidence-based, because anyone could write curriculum and try to have it implemented in a school district. And and say this is good curriculum, and we see it all the time. I do. I've been part and been asked to observe school programs, school curriculum, and it's never been evaluated. And that's not evidence-based. It has to be evaluated and having standards and valuation. And even there are programs, and again, I've observed them. I've even I'll confess, I've been part of that. After I retired and did some work for a health department, the Ohio the dentist, Ohio Dental Association had a program called Operation Tactics. And I was so good at it when they finally retired it, they asked if I wanted Dipper Dan. And I said, sure. Oh no, where's the picture of Dipper Dan? I've lost it. I don't know what happened to Dipper Dan. Anyway, there was and I'm so sorry I lost it. But it was a model of this guy that had Velcro pictures, and it started with him just having leukoplakia in his lip, and then as you would Velcro all the phases of Dipper Dan's face, the last Velcroed face was he had a radical jawectomy, no lower mandible, and it's horrific. It's a horrific model of his face, and kids were it is um, a dramatic, and it's a scare tactic, right? And we know that's not good prevention. Scare tactics don't work. It's horrific prevention. Yet there are still a lot of programs out there that have scare tactics. And again, that is not good prevention. None of the things I will share with you today will have scare tactics. We will not. We understand that is not good prevention. Again, SAMHSA has a lot of excellent resources that they will share. So, the first grouping of programs, curricula that I will share with you are curricula that has a fee attached to it. The first one that I'm going to share with you is keeping it real, keeping it real. And their tagline, and it's important. Not I won't share with you all the taglines of all of the programs, but it's important for keeping it real from kids through kids to kids. They have involved kids in writing the curricula, filming the curricula, and acting in their curricula. Um, it is 10 45-minute sessions. There are 5 videos in those 10 sessions, all youth related, all focused around decision making and refusal skills. There are there you can purchase these, not a real expensive curriculum. You can see the prices there, and then there are trainings available. I don't believe this keeping it real is in Spanish, but those again, that's the training is available for you, the remote training through a conference with their trainers. The next one, I imagine everyone will be familiar with, life skills from Botvin. They have earlier in the Echo series and in our meetings, we've talked about there's not a lot of curricula that has elementary programs. It does, starting at grades 3 through the full scope of from elementary through high school. You can see in substance abuse, they again have everything from grades 3 through high school. The curriculum is expensive and there are a lot of lessons. So some schools, that's prohibitive. They don't want an extensive amount of lessons. Some, that's not an issue. They do, though, and I thought this was really helpful. They have added curriculum that is specific to e-cigarettes and vaping, and also um, a virtual curriculum for students as well. Training is available. You have to, for any of their curriculum, you have to go through first a foundation training, and then there is additional training options available. There are those are virtual and in person available. So next one I want to talk about that's TNT, towards no tobacco use. Again, focusing on refusal skills, 10-day curriculum, not terribly expensive at all. Again, 10 lessons. Middle school, grades 7 through 8. Really, it's a one grade level of training that's available, just 2 boosters for training, and they really encourage training for their curriculum. Curriculum is not expensive, really, but for training, you can go to them or bring them to you. You can see the costs available, and I've included who to contact for the training. Liam Meza is the person that you contact. It's all there for you. Now, so I've included information for model smoking prevention program, and I've included it for one reason. In a lot of, so if you start searching for vape or smoking prevention information, you'll get a lot of state um, state prevention, vape prevention information, like Colorado. Colorado lists their evidence-based curriculum. Multiple Minnesota, the same thing. This is listed. So I don't want anyone looking at what's available at different state levels and then seeing this and say, well, Barcelo didn't say anything about it. I'm mentioning it, but I am disqualifying it. Why am I disqualifying it? It's published in 2016. It's not been updated. That's a disqualifier in my book. Maybe it's not for you. I'm disqualifying it. So if you still want it, even though it's published in 16, go for it. I wouldn't recommend it. Next is Project Alert, adolescent learning experience resistance training. Again, very heavy on refusal skills for 7th and 8th graders. This is totally free. Now we're getting into all the curricula that we're talking about moving forward, with some exceptions. It's basically free. This is all free curriculum, free training. So 11 course sessions, 3 free booster sessions, free online training. It's 6-hour training so it's quite extensive for faculty, anyone else that you would have that would want to be trained in it. There are videos, there's ancillary materials like posters, all animated, very colorful, very well done. It's being used in every state, so it's widely accepted. Again, all of these are evidence-based curricula that is recommended through SAMHSA. So moving on. So this, I wouldn't exactly say is curriculum to be used, um, but something that is worth mentioning. And it's through the CDC. Know the risks. So it's a presentation. There's a PowerPoint presentation. There are talking points. It's a resource. It's a resource great for teachers. If you have a coalition, faith-based organizations for presentations, you can see what they are here. Good resource. It's listed often as curriculum. Don't know that I would call it curriculum, but it's a good thing for schools. We're talking about resources for schools. This is a resource through the CDC. The next resource is through the Truth Initiative. They are master marketers, and this curriculum shows that they are great marketers. This is the grade level middle through high school. These are just 10-minute, 10-minute lessons. So these, again, I wouldn't say this is extensive primary prevention lessons, uh, but a great ancillary that could be used in a health class, in a homeroom, in life skills. Again, 10-minute lessons. You can look at the topics of each lesson. For some of you who have been to my presentation, here's like the first lesson that I have a copy of it, of the history of tobacco. I use this in my presentations. I believe all students should have an understanding of the history of tobacco in our country, the golden weed, and what the tobacco industry, how corrupt it is. So I love this. I wish all schools would use this. The next, again, isn't necessarily curriculum. I wouldn't call it curriculum, but it's a resource. And it's through Scholastic magazines, which we've all known. I grew up with it. And it's a magazine format, The Risks of Vaping, a good resource. All right, now we're getting into the heavy hitters, right? And there are two heavy hitters that we need to discuss. Oh gosh, we're running. Okay, we got 5 minutes and we're just getting to the heavy hitters. So I'm going to have to move real fast here, folks. So Catch My Breath is one of the heavy hitters. They have free curriculum, right? We're all aware of that from Catch My Breath. Um, they also we have a lot of options when we start talking about their curriculum. They also have additional lessons that you can purchase. Training is available. There's free training that you can get CEUs for. You can have live trainings that you can register for and pay for, and you can become a train the trainer that you can pay for. I love these supplementals. Look at them. You can use them if you use part of Catch My Breath. The PE are fantastic. How to to collaborate with vape education and PE, all excellent. Also, I highly encourage you, no matter what curriculum you use, look at the other resources available with Catch My Breath. All right, Stanford. Again, doesn't matter what curriculum you use, take advantage of their additional resources, such as their marketing and promotion materials. Here's an infographic that they have available, which anyone could use with any curriculum. Here's another thing, a poster, quitting tips for nicotine and cannabis. I just chatted recently with Bonnie, the creator of this, and talked to her about I believe in lozenges more than gum for youth, so they're swapping that out. Um, which is another thing that I would mention to you about Stanford. They are constantly updating their curriculum and their information, constantly updating it. That's not the same with other curricula. They are not in a constant update. That's extremely important. All right, crash courses. So you have staff that maybe is new to this to nicotine use. There are these crash courses that they can take. There is data. Let me move on real quickly. So you and me together, vape free. There is an elementary, grades 3, 4, middle, 6, 7, 8, and then high school. Uh, Elementary, 2 lessons, 6 lessons for middle school, 6 lessons for high school. Available for each and every lesson. Talking points, discussion guides for teachers. There are handbooks for students that you can print. There's even a workshop or guides for how to fold them. There's a Kahoot for every lesson. I just recently took a webinar on one of their programs, and I believe, and I did it in December, there are still incentives available to use. Alternatives to suspension is also available. I'm not going to talk about why. We know why it's available. There are 2 options available: My Healthy Futures and Our Healthy Futures. There's My Healthy Futures, and this is both for cannabis, for nicotine and cannabis. My Healthy Futures is a 60 minutes self-paced course. Our Healthy Futures is available in a 2-hour and a 4-hour session. There is a facilitator guide. There is training available. I love the handouts. I won't have time to talk about that. There are letters home. When we talk about home, I would be remiss if I didn't talk about PAVE, because PAVE is a great resource for schools. PAVE can do a webinar for your school system, great resource for schools. In-depth is an alternative to suspension for schools. It's available.
We were
Yes.
definitely wanting to talk about some restorative justice and confiscation protocols in our discussion. And I think that's all the time we have for resource sharing
Okay.
today.
I'll just split through these. There's not, and thank you. There's also my contact information that I will make available for you. Contact me. There's Bruce's Corner. Ask Bruce, and that's it. Thank you so much.